Thank you for coming to the Awake and Thriving podcast. Today we have with us our special guest, Dr. Elizabeth Hughes. She's a Stanford-trained physician with more than 25 years of clinical experience. And for most of her career, she believed that conventional medicine was the only effective method of treating illness and injury. Her perspective was radically changed after a patient was cured of a chronic incurable condition with a simple change in belief. Hi, Dr. Hughes. Welcome.
Thank you. It's so good to be here. Thanks for having me.
Yes. So can you tell us about this patient of yours that kind of changed your perspective on Western medicine?
Yes, I'd love to. So she was a woman with a sore on her leg, technically termed an ulcer. And she was a woman who was perfectly healthy, except her only problem, so to speak, was that she was 83 years old. But other than taking a baby aspirin a day, she took no medicines. She lived in her own home, played golf a couple times a day. She did everything you'd want to do as a person, let alone an 83-year-old. But she got a minor injury on her leg, which, despite doing everything right, gradually over 6 months grew larger and larger. And when I say doing everything right, she had been to doctors, multiple different doctors. She'd had 3 or 4 rounds of antibiotics, multiple cultures, scans of her arteries and veins to make sure that there wasn't a problem. She'd had bone scans to make sure there wasn't a bone infection. She'd seen vascular doctors. And then for 10 weeks before she saw me, she had been going to a wound care clinic twice a week, where the wound care nurses were gently cleaning the area and then using the same bandages that people who have had burns use. So she was getting this really high-tech intensive therapy. And every single solitary week after week after week, the wound only got larger. It did not get smaller. And so by the time she came in to see me, I'm a dermatologist, so she came to see me. I probably should have done it a little sooner, but for 2 reasons. Well, really for 1 reason. Somewhere in all the wound care, she had developed an allergy to something, and nobody knew what. And so the question was, what is she allergic to, Dr. Hughes? What is she allergic to? Tell us what we can use for bandaging. Because the next plan was she was going to get a skin graft. And the skin graft, and the doctor had told her, the surgeon who was going to do the skin graft told her, I don't even think it's going to take, but it's the only other thing we can do. So this woman told me everything. She came into the office, told me everything that had been going on. And as she told me, she sort of shrunk. I mean, she got smaller and smaller and more hunched over until she finally said, everyone tells me I'm old and I'm just going to have to get used to this and I can't heal. And there was something in that moment, and I didn't even recognize what was going to happen next, but I said, well, that's not true. And she all of a sudden sat up. And it was kind of this electric moment, sort of like if you meet the person you think you're going to marry or something like that. There was the same little sizzle and charge between us, because all of a sudden she sat up, and all of this weight of being ill was just gone. And it wasn't anything intentional on my part. Like, I did not think I was doing anything except telling her the truth as I saw it. All right. So fast forward. I sent her home with no treatment. And that was because her leg was so inflamed from whatever eczema there was, that it was impossible for me to put anything on her skin safely. And so when I encountered patients with this condition of, having tremendous allergy, I generally send them home with no treatment, because anything I do is going to make it worse. So I told her, put some Vaseline on your leg, wrap it with a loose gauze wrap, change it once a day, see me in 3 weeks. And I really thought at that point, okay, then we can start allergy testing. We can figure out what's going on. That was what was running in my mind. 3 weeks later, she walks back in and she says to me sort of apologetically, I don't think I did this right. And I unwrap her leg and the ulcer's gone. not just the eczema is gone, the ulcer is gone. And this woman had had 6 months of intensive tens of thousands of dollars of treatment, and 3 weeks of believing that her body wasn't too old to heal, and the ulcer was gone. And she just didn't know what to make of it. And I just went like, what happened here? And more, why haven't I been doing this for other people? Like, what if how many leg ulcers had I treated? Thousands and thousands. Why did this one get so much better when I did nothing other than talk with the patient and inadvertently change something? And it took me a while to unpack what I'd done. Like, it took me a while to figure out what was this? And then I just had to figure this out. I just literally had to figure this out. I often think that I put myself back through medical school with all the studying that I did to get the answer. And it's led me to where I am today.
Ooh. And looking at all the stuff that you do have going on today, you have stuff, PSYCH-K, and then you work with energy modalities. So do you think that combination played into your patient's healing?
I do. I mean, what I've really realized is that people walk around with a set of subconscious beliefs about their health that they're very frequently not aware of. And sometimes they come from family members, even family members who were loving and caring and wanted to make sure that people stayed safe. Some of it's from society, what we hear out there. Like, this 83-year-old woman believed she was old, so she couldn't heal. And somewhere that was out in the ether, and she believed it. So we're all walking around with this set of subconscious beliefs that we don't recognize. And those actually affect how our body functions in very, very specific ways. And that's what some of the science like psychoneuroimmunology shows, that what you think directly affects your body's function. It affects your immune system, it affects your hormones and your nervous system.
So do you think that is why certain people or some people get sick more often than others, whether it be colds or stuff like that?
So, all right, at the risk of sounding like I'm blaming the victim, which I don't want to, I really don't want to, because if you're unconscious of the fact that what you think and how you feel at a sort of gut level, how you feel about your health, if you're unconscious of that, you will get sick more easily. You will have a harder time recovering. You will not have the same results from medicines. I mean, even if you look at a regular medicine, some people will get fabulous results, and some people won't. And I think it's that set of subconscious implanted beliefs that we have that we don't even recognize that are there. That makes the difference between good recovery and easy recovery and not.
Yeah, I totally see that. And this is going to be controversial a little bit, but I can see how it plays into what is occurring right now,
Yeah.
Worldwide, because
Yeah.
there's a lot of fear in people. There's a ton of fear in people, and I don't feel like that plays well with our body right now when it comes to what's occurring outside.
Yeah. Oh, I'd love to talk about that, actually. Really, if we have a moment, can we talk about that?
Yes.
Okay. So I'm for people who already know something about hormones and the immune system, I'm going to do a little review, and I apologize if it seems a little basic. So we have hormones in our body that are the stress hormones. They're produced by the adrenal gland mostly. There are some other ones, but the big ones are produced by the adrenal gland, including cortisol, or which we take artificially as prednisone or Kenalog, but it's cortisol that we make. Now, too little cortisol and your immune system doesn't work. Too much cortisol and your immune system doesn't work. There needs to be this balance. You have to have a certain amount. But it's well established that cortisol levels are raised in situations of stress, fear, anxiety, and that's true for humans, it's true for animals, that's what everybody knows. Okay, so, and when you have very high levels, the immune system will shut down, which is why for autoimmune diseases, as a doctor, I give those steroid medications because I want to shut down the immune system. Okay? All right. So here's the research. A group of researchers at 3 major hospitals in London started routinely testing their COVID-19 patients between middle of March, roughly, and middle of April. And they tested, along with all the other blood tests you get on admission to the hospital, they tested the baseline cortisol levels. And the researchers' thoughts were maybe people don't make enough cortisol so that their immune system can't function. Because remember, too little cortisol and your immune system doesn't function. They found exactly the opposite. They actually found that people with the highest level of cortisol production, well, first off, everybody had increased cortisol production, which was interesting. Everyone was. But the people with the very highest actually had a significantly higher death rate. So that every time you doubled the cortisol level over the normal, it led to a 42% increase in death rate. And it's important to remember that this wasn't people who were they weren't having their cortisol levels tested when they were on a ventilator or when they had already been hospitalized and were under stress and were sick, because that's a very stressful. They were being tested on admission, like before maybe all of the fear that had come into the hospital and of being in the hospital. So I think this is, I'm going to be controversial, but I think this cortisol level is a proxy, sort of an indirect measure of how much fear a person is experiencing at baseline. And this is a really, really interesting hint that maybe that fear is what's causing people's immune systems to go awry.
Yeah, I find that some of my friends that I speak to that watch the news, they're terrified, like all the time. And they call me and I'm like, you need to calm down. It's okay. Don't watch so much news because it's the same thing on repeat. And it just seems to escalate day by day.
Yes.
So like when people pull away from the news for at least a couple of days a week, they calm down a little bit, and that'll probably affect their cortisol level as well.
Yeah, absolutely it will.
I like this. Yeah, that's kind of what I've been thinking as well. So I love that there's been actually research on that.
Yeah, it was fascinating, and especially because the researchers got exactly the opposite response of what they wanted. They thought that there was something wrong with the cortisol, that it would be too low, and and finding it was too high. Yeah.
Interesting. All right, so we can go everywhere with this. Let's go. So I'm a brand new patient, and I went on your website, and I can get a consult with you. But
right.
I'm not going to, we can't do one here. But I wanted to know, like, when I do a consult with you, say I book one, what do I expect? Like, do I have to bring medical records? What do I expect from like a first visit with you?
Yeah. Well, so first off, I work only virtually because I work with people all over the world, actually. So if you speak English, I can work with you. Yeah, so that's fine. So what I like to know during your first visit is a little bit of your background, what you've tried, what you haven't worked, but we're really going to ask some questions about what do you believe about your health? What is it that family members have believed? Looking for things like patterns that you might not even be aware of. Doctors, regular doctors, and when I am wearing my regular doctor white coat, I ask about family history, about, is there cancer, is there heart disease? But while that's interesting, I'm more interested to know, how did your family think about their health? If everybody in the family had cancer, quote unquote, was that something you were told all the time? Was that something that was reinforced? Oh, this runs in the family. Was there a belief that that you can get sick very easily, or that some, like, we don't recover well, or we're fragile? It's all of those beliefs that the body is anything other than strong, resilient, self-repairing. Those beliefs are actually causing a subacute, low-level, unrecognized amount of stress about just being in your own body. If you always think your body's booby-trapped or about to fall apart, think about it. How stressful is that, right?
Yeah, very, very stressful.
Right.
Okay. So family beliefs, I can see that playing just in my family, just like little things that they would say, and I've had to, I guess, reprogram myself. And I'm like, no, that's not me. That's not me
Right.
at all.
And it's really super funny how different things will hit you at the right moment in childhood. I have a dog who has 3 legs, and I love to walk around with the dog because everyone asks, "Oh, what happened to the dog?" Well, the dog had cancer. The dog's leg, could not be repaired, so he had an amputation. Now, that happened 3 years ago, and the dog is totally fine. But it's amazing when kids walk up to me and kids will say, "Oh, what happened to the dog?" And I'll say, "He had cancer, but he's fine now, and he does fine." So I've seen little 3-year-olds say, "Oh, he had cancer, he's going to die." And I was like, "Ooh, where'd you get that?" But I think it was probably some quick, something that the child just got. Grandpa died because of cancer, so cancer equals death. Well, what's going to happen to that person if that person should get cancer down the road? Like if cancer equals death, that's where you're going to go, unfortunately.
Yeah, that's their only belief. That's the only thing that they've seen or heard
Right.
of. So
And
unfortunately,
they won't even recognize that that's abnormal. And if you go into a regular doctor who starts giving statistics and says, "Well, yes, there's a 50% chance of, blah, 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 survival and blah, blah, blah," you're going to hear death, death, death. And you're going to get it reinforced by a regular doctor, unfortunately, because that's medical practice. That's what we do.
Interesting. I like that, because I feel like our mental health and our physical health really tie into each other in a way that I think we're just scratching the surface on how important those two little functions are for us, for
Right.
well-being.
Mm-hmm.
Because you see people that are physically fit, but once something hits them mentally, they'll deteriorate so quickly.
Right. Or you see people who are, trying to, let's say, lose weight, but believe that everything they eat might make them fat. Well, it doesn't matter if you're eating salad. You're not going to lose weight if you believe, if I eat, I get fat.
Yes, and I find this is really out there, but for me personally, I know that when I'm trying to maybe lean out my body a little bit more, if I focus differently on the food I eat and my mentality, I change it, I can see my body changing in a way that I want it to change.
Yeah.
Instead of like looking at like you're saying, like, oh, this is gonna make me fat, this is gonna make me fat. If I think of it like this is just healthy, I really do, my body really does change.
Yeah. And you point out something really interesting there, is you can't think, "Well, I'm not fat." Like, you can't just use the not or the negative idea. You have to use the positive thing that
Yeah,
you want. Like, I'm
exactly.
healthy. Like, this is healthy for me. This nourishes me. That's the way to go. You've got it. Bang on.
Yeah, it totally works for me. And when I'm going through a little phase, I'm like, no, I just have to rethink this, and then it just works out. So I wanted to talk to you a little bit more about the energy modalities that you work in. Can you
Yeah.
tell me a little bit more about those?
So one of the main ones that I use is a process called PSYCH-K, and you'll probably spell it out in the show notes, right? Yeah. Okay. So PSYCH-K is a method of belief changing, subconscious belief changing, where in a few minutes you can have a physical, energetic experience that there is something new and something changed. And do we have a moment for me to tell you how I discovered
Absolutely.
it? Yeah. All right.
Yeah.
So I was doing a health coaching program, which was more spiritually, mental, emotionally based rather than just nutrition based. And it was aimed at physicians. And so we had these really, really high level, like super duper awesome speakers that were speaking to us as part of the program. And one of them was a man named Dr. Bruce Lipton, who is the father of epigenetics. He wrote the book, The Biology of Belief. And in this book, I read his book, and he mentioned PSYCH-K as a little thing. And I was like, oh, I wonder what that is. You know how sometimes you see something, you say like, I wonder what that is, and you follow it. So I decided to get trained on this modality, not knowing anything about it. I didn't know a thing about it. And really, I'll make this story super duper short, but basically in 10 minutes at the first day, you're not 10 minutes in, but in about 10 minutes during the first day of my training, I was cured of a lifelong cat allergy. And I know you're like, what? So right. So the woman who was doing the training decided to hold it in her home because she had a limited number of people. So rather than rent a hotel room, she had a big enough home that we had it in our home. And I saw that she had a bunch of cats and cat towers. And I was like, when I walked into her house, and I was like, oh, I don't know if I'm going to be able to take this. Like I'm allergic enough. I'm going to be feeling this in a few minutes.
Yeah.
And so we got together, we met, like any workshop, we introduced ourselves. And then about an hour in, she said, all right, let's take a break. Everyone go get some coffee. And by the way, is anyone allergic to cats? And I said, me. And she said, okay, come with me. And she took me back into her office, and we did a little PSYCH-K process, took about 10 minutes, the course of a break. And I was like, boom, I felt this, like something like got me. And I spent the rest of the 3-day workshop at her house without sneezing once. Her cats were in and around and all over me. I've since then been able to like have cats in my lap, and I kind of like cats. So, like now I can go back to like petting them. I have no problems with cats anymore. And it took about 10 minutes. And I was like, wow, that made me a total believer.
Oh my goodness, I love cats. I didn't develop an allergy to cats till I was an adult. And it's bittersweet because I still love petting cats, but I have to take an allergy pill and I have to wash my hands thoroughly because otherwise I'll have hives on my neck. But
Yeah.
I loved them so much I actually owned a cat, even though it was a tough time for me.
Yeah, I know. Yeah. So PSYCH-K can do that, change those beliefs, also can be used to get information from symptoms. I mean, what's very interesting is symptoms often come along to give you information. We don't look at them. We look at them as enemies, but instead we're not getting the data that we want, because your body's never trying to harm itself. It's trying to tell you something.
I love that, and I so believe that. Last year, with my career, super, super stressful, and there was a ton of changes going on. I was probably under more stress last year than I've ever been in my whole entire life. And I feel like that my skin started changing in the middle of that stress.
Yeah.
And I feel like that was a huge indicator for me that things needed to change because my body was like, this is not working for you anymore.
Right.
I'm still dealing with the skin thing, but it has significantly resolved since then, just with all kinds of different things that I've been doing. But I feel like stress can definitely activate maybe some kind of genes, energy. I'm not sure what it does, but it definitely affects us.
Right.
with that.
Well, and the funny thing is most people recognize that stress causes skin problems at baseline because everyone's had or has known someone who's had worse acne around midterms or finals or, stressing out about anything and there's acne flares up. And this is true for the whole body. It's not just limited to acne or
Yeah,
let's say if a person has eczema or something like that. It's not limited to the skin. It's just the skin is your first point of contact, but it's true throughout your body. If we could look at our blood vessels the way we can look at our skin, if we could look at our kidneys, if we could look at our intestines, we'd see the same things happening in response to stress. It's just we can't look at them in the same way, so we ignore it.
yeah. So I feel like, do you think, and this, I don't even know, I don't even know the answer, and maybe you do.
Yeah.
Do you think your skin shows what's occurring inside? So like that's the last, not the last frontier, but it's the last thing that pops up when already your organs inside have been having issues. Does that make sense?
Yes, that does make sense. And there are, all right, so speaking from a straightforward medical context, there are a few skin issues that are related to internal issues, but not every one. So that's the straightforward medical answer. The sort of outside the box, non-conventional medical answer is, I believe that different people have different organ systems that are their own, let's say, like alarm system for stress. So for some people, it might be headaches. People might have migraines, and it might be that's their little signal that something's going on. Another person, it might be skin. Another, it might be their intestines. Like they might just feel tied up in knots, or they have irritable bowel syndrome. Another person, it could be asthma. Asthma is highly, highly stress related. And I think that's, I'm going to be honest that I don't know enough about how different organ systems play out in different people. And I think it's very unique. But I think that each of us, I want to call it kind of your target, like your signal, your sentinel, this is the thing that you're going to notice with just stress. And I was actually working with someone recently who had some chronic knee pain and he wanted to get the knee pain. One of the other energy medicine modalities or modalities I use as a way to get information from sort of your higher self and your life purpose and how illness plays into that. And the answer I got was, you don't want your knee pain to go away. Your knee pain you don't want it to go away entirely. You need a little knee pain because your knee pain is going to be your road sign that says you're veering off course. So if you try to totally get rid of the knee pain forever and never have it come back, you're going to miss information. Doesn't mean you have to be in pain all the time. It just means you want to use it as a signal.
That is such a different way looking at it, but you're right. Depending on the person, certain things act up with them. That is that's their first indicator that something's amiss or going down the wrong path, whether it's knee pain, having IBS, all kinds of things.
Right. It doesn't mean you have to be in pain or discomfort all the time. It just means that that it does, unpleasant as it is, serve a purpose.
Yeah, you're right. Our body's really just trying to tell us some stuff. It wants to heal us, but it also wants to put us in the right direction because our bodies are amazing. I think we really do take for granted all that it does for us without us having to consciously do it.
Right.
Interesting. Okay, let's see. What kind of resources have you used or are you using on your journey from Western into holistic, bridging that over?
Yeah.
And what kind of response have you gotten from Western medicine physicians? That's what I wanted to know.
Oh, I love this. Okay. So lots of different resources. As I said, I found a health coaching program that really seemed to be looking at the questions that I was interested in. That health coaching program was specifically for physicians and healthcare providers already. But led by Dr. Lissa Rankin, who wrote a book called Mind Over Medicine. And so she's an MD, a gynecologist who sat down and looked at the research of how our mind affects our body in one way. I already mentioned Dr. Bruce Lipton and his book, The Biology of Belief. Dr. Candace Pert, who is the founder of the field of psychoneuroimmunology, which is how your thoughts affect your immune system. She wrote a book called The Molecules of Emotion. And you know what? I will send you all of these books so you can put them in the show notes too. So you'll have these. There's a great book by a UCLA psychologist. He works in the hospital, Mark Schoen, called Your Survival Instinct is Killing You. But what I did was, what was really funny is you can't just go back and say, okay, I want to learn everything I need to know about this. Like, that's the funny thing. And it's very uncomfortable for me at first, or it was uncomfortable to think that there wasn't some certification that I could go out and I could be done, because I'm not done. You're never done. So it's like you read one book and they reference someone else, and you read another book and and so you read that book, and then you listen to that lecture, and then you go and talk with that person, and you go and study with another person. And I've done a bunch of different things. A yoga teacher training, that was incredibly informative for me. I've done work with a shaman. Like, I was, trained with a shaman for a while, and I discovered an amazing group of things. And I would never call myself a shaman, because I don't do conventional shamanistic looking things, but it informs my work. It's like, so that sort of thing. I do work with the Akashic Records, which is, the record. So I read the Akashic Records, and I found my way to doing that. So there's a whole bunch of different sources that when you start asking the question, the resources come to you, and then it just takes a while to integrate and feel like this is the right place I am, which you will be for about 20 minutes. And then you have another question, and that's okay.
Lead you down another path. You're like,
right.
Oh, I can go down this path.
Right. Oh, I just discovered a quantum physicist called Dr. David Bohm, who I just started reading. Actually, I'm getting a book by him with like his elementary quantum theory textbook, believe it or not. He was taught at Princeton and at Berkeley and et cetera. So, I mean, great guy. But he, from a physics standpoint, was asking some of the same questions about how thought affects matter.
I love that we're here. I love that we are on this threshold and really going down this road, because I feel like there's so many things that we have yet to discover, so many things untapped, because it's like, I don't want to say it's like the Wild West. It's not, but it's a new frontier for us.
Well, yeah. What's wrong with the Wild West?
The West, but it's a new frontier. There's just so many doors and avenues we have yet to discover. And for the whole medical community, holistic and Western, for people in general, it's going to be life-changing for us.
It is. But you asked a second really interesting question, is how do my conventional medicine colleagues respond to this? And it's very interesting. I have some people who are like, oh, thank goodness you're talking about this. Oh, thank goodness you're saying this. And then I have another set of people who are saying, you're wrong, basically. But not in the nicest of ways. I've had people, I've done things like quoted information from the CDC and said, look at this isn't making sense. And then a person will, I think, reflexively message me back on social media and say, well, you should read the data. Here's the CDC guidelines. It's like, didn't you just see that that's exactly what I was quoting and saying there's something that doesn't make sense data-wise? And they're saying, like, you should learn the facts. And I'm like, you just sent back the same article that I was quoting. So doctors have been steeped in fear and illness and seeing what's wrong for so long that it is very, very hard to switch and start looking at what's right, and to switch and start thinking about yourself less as this sort of white-coated demigod who can heal everything, and more as a guide. I think that we need some of both. I mean, let's be honest. If I broke my arm, I am going to go and get my arm set. If it needs surgery, I'm going to get it set. But I think there's no problem with that if you choose it. But as far as all of the illnesses that kill people, if you look at the top 10, or you look at the things that consume the most healthcare expenses or the most prescriptions, all of these are stress related or in some manner. And when you're saying stress related, remember you're saying thought related. and so that type of illness, that type of condition does not respond purely to conventional medicine. And if we're going to make people truly well, we need to embrace something different to eliminate those conditions rather than manage them.
Yeah, definitely. And I definitely see, because on my side, when I've worked with tons of physicians all the time, like neurosurgeons, trauma, a lot of surgeons, and some of them are great. Like I've worked with some amazing ones, but there's some egos involved as well. I've had some surgeons say, what is the father of gods? There's a father of gods, but that's what he liked to call himself, that he was the father of all the gods. He was a neurosurgeon. And I was like, okay, so you're never going to see anyone's point of view because you're the father of all the gods.
Right.
But then there's like great down to earth ones that are just so easy to talk to and you would never know. And that's what I want, like just an open conversation, because a lot of people that aren't in the healthcare field, they don't know to look at other places. That's why I started all this, to give people education, to get people on the show that are reputable, that have a great background and experience to educate people that aren't in the medical field. I've encountered plenty of people that are nurses or doctors, and if you don't, you're right, it is the Wild West. We don't really have an exact thing. How do you, like, you read and do all this, but people that are from the general population, they'll go to, say, nurses, and they'll ask them, so how do I optimize my health? And they're not really trained in that. And what I've seen is, and this was a really turning point for me personally, is I saw this nurse, and she's great. She's great for clinical. If you're in the ICU or something like that, you want her as your nurse. And there was these two young girls that are educated as well. And she was giving them lessons on how to exercise and be healthy when she's a smoker and morbidly obese, but was a trainer 20 years ago. And I was like, but she's a nurse. So everyone was like, oh, so she knows. I'm like, no. There's something like totally wrong with all of this.
Right.
That's what set me down this path, because I think the general population thinks that if you're a nurse or a doctor, you know how to optimize them and do all that. And it's not necessarily true, because we're in the frontier right now that we're just diving into it.
Right.
And we're like the front runners.
You're a front runner too.
So, but yeah, okay. I love that. I love hearing people from the Western side, their colleagues' perception coming in, because I know my side hasn't been easy. If it's not in black and white, then they're just questioning it constantly.
Right.
So, all right. So you went through the recommendations for the books. Like, that was one of the questions I was going to ask you. I was like, oh, look at her. She's answering all that question.
I'll send you all that info.
Perfect. Okay, let's see.
Oh, there's one other book I want to add, which is When the Body Says No by Dr. Gabor Mate. I'll send you that link too. He's a family practitioner in Vancouver, Canada, who has, this is more story-oriented, story-based, and a little less deeply scientific, but it's fascinating. It's an amazing book.
Okay, yeah, I would love all the titles you've been telling me. I'm a bookworm, so I would love to get my hands on those books. Is there anything that I didn't ask you because I didn't know enough? Like anything that pokes out? Because there's some things like I don't know. Like I read a lot about you and I have your bio, but is there anything just about what you work with, the people, the clients you work with, and the patients that I just didn't know to ask that you think our listeners might want to hear about?
You've been pretty thorough. But I think if there was one thing I was going to clarify about what I've been talking about, where I've been talking about beliefs and thoughts, and I think that that is important, but your emotions and your feelings is sort of, you've got to have the two of them in line. So I think a lot of people think that you can just think happy thoughts while you're feeling not good. For instance, that nurse you just talked about who was telling people how to exercise while she was smoking and being morbidly obese, it's because there was a sort of head-body disconnect. So she knew the information, and it might have been really good information, but there was something internal about how she felt that kept her from acting on that for herself. And making that really, so we've got, I think about it, we've got really 3, maybe 4 brains. We've got the brain up here on the top of our head. We've got an equally complicated nervous system in our heart that runs independently. And then another nervous system in our gut that runs, again, independently. And then there's the nerves of our peripheral nervous system, the things that let us do stuff automatically that we can do too quickly, like type. Like if we have to think about typing, it takes so long, but when you learn how to type, it can just fly. So we've got all of these parts, and we're in the habit of thinking that all of our, or believing that all of our like conscious rational thought occurs here, but we leave off these other parts of our body in terms of having a wisdom and an intelligence and an opinion, and everything has to be in line. Like everything has to be in line so that what your physical habits are doing is lined up with how your gut is feeling, is lined up with how your heart is feeling, is lined up how your brain is feeling, all of that. So that health isn't so much a set of beliefs, it's a feeling. It's an almost transcends words feeling. And too many people have lost what that feeling is. So if I could leave one thing with everyone, let's work on feeling healthy. Forget what your thoughts are about it, particularly, like, because the feeling of health goes beyond just a set of words.
Yeah, I feel like we can apply that to so many different parts of our lives as well, not just health, but some people unfortunately don't know what it feels like to be accepted, to be loved. And so they can say it, they can do affirmations and work on it that way. But if they can't tap into that feeling, it's hard to make that transition a little bit.
Exactly.
Okay, so I'm going to ask you some fun questions, okay?
Excellent.
All right. So what is your favorite meal to have?
Oh, wow. I like food. Gosh, right now, I'll ask for today, I am really craving a really nice piece of salmon, probably with some like asparagus. And I kind of like fruit. Like if there's only one thing I could ever eat for the rest of my life, it would be fruit. So like this enormous fruit salad, that would make me very happy.
I haven't had a fruit salad in a while, but I always am grabbing like fruit at the grocery whenever we go to the grocery store.
Yeah.
So,
Yeah.
perfect. And let's see. What does wellness mean to you?
I think I've hinted at this already, but I really think that wellness means believing in sort of all the way through down to every cell of your body that you have the power of health, that you are fundamentally healthy and you can access that health at any point. It's a great skill to have. It's I think a necessary skill that we should all be developing. And I think when you have that, that is being well. It's not, And it helps you survive anything, you know, like it will help you survive a situation where maybe you can't eat the right thing, or you don't have access to the water, you know, like I have to have 5 liters of water a day or something. Like, no, if you're truly well, you know, you can weather those changes.
You've kind of intertwined both avenues that I've been working in so beautifully.
Well, thank you.
Um, so I loved having you on. Thank you so much. I really do appreciate it.
Oh, it's been awesome. I have so enjoyed this.